thank you. Did you have a good holiday?
Yes, I did. And you?
Yes, I did. Kept it small, right?
Yes.
Okay, you too.
Yeah.
Well, good morning, everybody. Thank you for joining us for our press briefing that we are doing to talk about the state's response to the pandemic. As I said last week, we'll be doing this Monday, Wednesday, Friday for the next couple of weeks at 10 a.m., so we'll have a consistent time for everybody. As always, we remind people that we got the pandemic, that the virus is still out there in our communities. So please, folks, continue to use the tools we've given you to slow the spread of the virus, and remember to follow our rules. So that means make sure that you keep that 6 foot distance between you and other people when you're out in public, that you wear a mask when you go to the store, that you wash your hands for 20 seconds at a time, that you stay home from when you're sick. That's an important thing to do. That is going to be a big deal. Please do not, if you have any sort of symptoms, stay home. Obviously, you can go get tested, but we want you to stay home so that you don't take the chance of just spreading it to somebody else. Work from home if you can. When you go to the store, go once a week, go by yourself. These are all things we can do to be able to slow the spread of the virus. And of course, we want people to avoid the 3 C's. It's a virus that spreads from one person to another. So if you avoid those crowded spaces or those crowded places, confined spaces, close contacts, you will help slow down the spread of the virus. Again, good ventilation will help do that, especially as we're all going inside more now that the weather's getting colder. And of course, if you cannot avoid those close contacts, wear a mask. That will help slow down the spread of the virus as well. And of course, all of this is about making sure that we preserve our hospital capacity here in the state of Nebraska. Right now, we got 32% of our hospital beds are available, 27% of our ICU beds are available, and 68% of our ventilators are available. We also are sitting at 896 coronavirus hospitalizations here in our state. Just put that in context of October 1st, we had 227. So we have seen a decrease in the number of hospitalizations over the course of the last week or so. But we want people to remember, please continue to help us slow this down so that we don't overwhelm our hospital system. That's going to be important. Our doctors and nurses are working around the clock to take care of people, so we need to help them out by slowing down the spread of the virus. So please help us do that. That's going to be very important. And again, you'll recall that a couple of weeks ago I had published our focus on the hospitalizations with the different charts. We're in our orange zone right now, between 20 and 25% of our hospital beds being taken up with coronavirus patients. If we hit 25%, that means that we will have additional restrictions like a 10-person rule on indoor gatherings, 25-person rule on outdoor gatherings. Bars will have to go to carry-out only, carry-out, take-out, drive-through only. Restaurants will have limited hours. Again, we can avoid those restrictions by slowing the spread of the virus and making sure that we don't have more hospitalizations. So that is our key messages we always want to talk about. Of course, another way that you can help fight the spread of the virus is by getting tested. Test Nebraska is out there and available. We've delivered 473,000 test results back. Nearly 550,000 Nebraskans have signed up and done an assessment through Test Nebraska. So overall, we've had over 1.5 million assessments done through Test Nebraska. You can sign up, look for a schedule to get tested, especially if you're coming back from the Thanksgiving Day holiday. If you traveled to go someplace and visit with folks or had a large gathering, coming back and getting tested through Test Nebraska is one of the ways to make sure that you didn't bring something back from your Thanksgiving holiday. So please take advantage of Test Nebraska. All right, so today we're going to have our John Hilgert, who is our director for the Department of Veterans Affairs, and talk specifically about his experience with coronavirus. He had it earlier in the year, and of course it's also relevant to our long-term care facilities, our veterans homes, where we take care of our veterans here in the state. And he's going to talk about how we can take steps to make sure that we're helping out with our veterans homes. We know that long-term care facilities where you have congregate living are places more at risk, right? You have people living together, and again, you've generally got older people with underlying health care conditions, so that puts them at greater risk. So we have to take special steps to be able to make sure that we're protecting those folks, and John Hilgert will talk about that. So John, I'm going to turn it over to you.
Thank you, sir. Good morning. I wanted to come and say a few words, and I appreciate the governor allowing me the opportunity to do so. I did have COVID-19 in May of this year, and so did my family. My family's case was rather mild, although my wife still can't taste. It's coming back very slowly. Mine was a little bit more than mild, but not much. I was not hospitalized. But it was very disconcerting. It came on very rapidly, had a very high temperature, had the shakes, the sweats, the whole 9 yards, and then a few days of very muscular and joint pain, to describe it. Sleep was not to be had. So I would, dutifully, I was isolating by myself. I was charting my temperature every 2 hours, trying to find baselines and so forth, where it was going, made sure my acetaminophen dosages were on the hours and so forth. And I ended up getting sleep. It was about 20 minutes after I would take a couple of Tylenols, and then I would be able to sleep for a little bit, and then that would wear off, and then here we go again. So days and nights became kind of blurred, so I thank goodness for Netflix, right? But anyway, after a few days, I was able to sleep, and I got better. And may have some residual impacts. I'm going to go in for some tests tomorrow. But I made it through. But yet I have a different perspective, because I also am the director of the Nebraska Department of Veterans Affairs, and we have 4 veterans homes. So I see what that means, COVID into a long-term care facility. So if you think that, well, I'm young, I'm healthy, I'm asymptomatic, I don't have to worry. I would say that, yeah, you do. Because your friends that you associate with that are also perhaps young and healthy as well may be a housekeeper at a long-term care facility, a med passer, a CNA, someone who works in dietary. The thousands of healthcare workers that we have across the state may be exposed asymptomatically if you don't take the precautions. And imagine for a moment a healthcare professional, your chosen profession, coming into a long-term care facility. And we have this screening like all long-term care facilities do. We take the temperatures, we go through the history, have you been exposed and so forth. But when this goes into a facility, it's usually from an asymptomatic teammate. And imagine the distress of someone who's chosen professions to help others, bringing that in. They're crushed when they find out that they're positive. And we've had COVID cases in our 4 veterans homes. We've had teammates that have been exposed and have had COVID. So when you're going through the decision process of, should I wear a mask? Of course the answer is yes, and maintain the distance, and wash your hands, and the 3 C's. But when you're going through that decision process, I would ask you not only to think of your own situation and even beyond your immediate circle of friends. One step over the horizon, think of those folks, the veterans who've sacrificed so much. This is not a huge sacrifice compared to serving in the military. The healthcare workers whose chosen professions are to serve them throughout all of our long-term care facilities. You could really be a big help. You have a part to play in this by wearing the mask, by being socially distant, making good decisions, wash your hands, the 3 C's, the crowded places, close contact, and confined spaces. And we really need your help to do that. When at our veterans homes, and with the other long-term care facilities, when a staff member, teammate, we identify our staff as, becomes positive or exposed, they have to leave the facility and self-isolate for 14 days. That creates a hardship on the remaining staff members. That's more overtime, more stress. People like to say that our healthcare workers have worked tirelessly since spring. I know that's supposed to be a compliment, but I'm here to tell you that they are tired. They're not tireless. It does have a strain, and their operational tempo has been very high. In our veterans' homes, we've done all the things that are directed health measures. ICAP, thank goodness for them. The HHS has advised. We've done things like we've retrofitted some of our HVACs with UV lighting to help kill the virus as it circulates through the home. We've tried to boost our humidity up over 60%. We were told that that might help in transmission. Of course, from early on, we've went through, and every single individual, including me, everybody, when they go into a home, they have a questionnaire, they have a survey to take, they take the temperature. We do all of those things that all long-term care facilities do. But when it's spread within the community, it's hard to keep it out into those long-term care communities. So that's why I'm here to ask you to help us out. This is the Nebraska way. Everyone who's grown up here has been in a snowstorm. And what happens usually the first snowstorm of the year? Someone's car can't make it up the hill. And what do? You get out and help them push. No one's mandating you to do that. No one's telling you you have to, but you know it's the right thing to do because your neighbor needs assistance. And that's all I'm asking you to do, is to help out your neighbors one more time. For the next several months, please be safe, wear your mask, socially distance, and wash your hands. It'll help and make a difference for not only our veterans in the homes, but our healthcare providers that serve them. They would appreciate your help. Sure.
Thank you very much, John. I appreciate it. Also, want to remind people that today is Cyber Monday. So we had obviously Black Friday on Friday, Small Business Saturday we talked about last week. Yesterday was Small Brewery Sunday. You can help your brewers out by picking up a growler. And today with Cyber Monday, you can help by shopping at those local businesses and be able to give them business as well. So please remember your local businesses when you're talking about your Cyber Monday shopping. All right, and then just again, reminder that Wednesday, December 2nd, 10 a.m., we'll have a press briefing, and then on Friday, December 4th, we'll have a press briefing, and we'll continue to update you with regard to our response to the pandemic. John, thanks again for joining us here today. Appreciate it.
Sir.
And thank you for sharing your story. And with that, actually, I don't have any questions that were submitted ahead of time, so we'll go straight to questions from the folks in the room here today. Martha.
No relation.
No relation. You want to come back up?
So, you said you may have some lingering effects when you're going to get tested?
Yeah, the lingering effects, the question is, I said that I might have some lingering effects, and yes, that's correct. I need to go in for some tests, and I have unfortunately, love my dad, but I have heart disease in my family history. I'm 56 years old. My dad passed when I was 15, when he was 55, so it's something we're keeping a close watch on. Different heart anomalies can be explained as someone who's recovered from COVID-19. It's a lingering effect. It could be hereditary, could be stress. So we just need to examine those things and ferret it out and to ask those questions. And I think that's what anyone who closely monitors their health should do. If they see something happening that's abnormal or causing them a concern, they should go to their healthcare provider and figure it out. I think, frankly, one of the silver linings, if there is one, to this pandemic is a greater awareness of your own health, a greater reliance and importance on our public health system, and I think we're going to be a smarter community as a whole going forward. Yes, Andrew.
John, I noticed that you were wearing a mask. You know, you've had it. Why do you still wear a mask?
Oh my gosh. Because I don't want to get it again. They say that you can't because there's antibodies, but then there's some that says that you can. I wear a mask because it's a sign of respect. It's selflessness. It's something that I'm doing to show my teammates and the people that I come in contact with, I don't only care about my own health, because they don't know if I've had it before. But I care about yours as well. That's why I keep on wearing a mask, and so does my family.
How many cases have you had in the vets homes among residents and among staff?
You know, I'm gonna have to get back to you on those exact numbers. We've had more, we've had over 48 current positive individuals that are within the homes. We have much more than that as far as teammates that are either positive or self-quarantining. We've had also dozens that have recovered as well. We've have 3 times, I think, the amount of recovered teammates than that are currently self-isolating. So that's helpful because those teammates that have recovered, although wearing the masks and the PPE that we have plenty of, we're in good shape there. They're have that sensitivity, and those are the folks that we would rather have work with some of our positive members. And I would like to add one more thing about when you're positive, you can run the gamut of severity. The public health, and you know, I'm so glad when I was in the legislature we used that cigarette money, right, to make the public health systems. That was great. They're doing a wonderful job. We're testing our teammates on a weekly basis. So we're seeing when a teammate becomes positive. And then as need be, where that teammate worked, we're testing those members in that neighborhood as well. So it's not uncommon that we're getting positive indications from some of our members that are asymptomatic or very, very, very mild symptoms. And that's a good thing.
So you say you have 48 current positives, and that's among all?
All 4 homes. All 4 homes.
All 4 homes, and is that just residents?
Yes.
But that's not the total you've had since the beginning?
No. There's many residents have recovered. But again, I don't have those numbers for you, and I can get those. Holden Armstrong, our Public Information Officer, Communications Director, we can get you some more information on that.
And have you had deaths?
We've had people who are COVID positive when they've passed away. We've had 15 so far since May, well, since the beginning, I should say, and that's all 4 homes combined.
Chris from NTV is asking, John, what is the status of the Veterans Home in Kearney? He said last I checked it was on lockdown.
Well, I wouldn't call it necessarily lockdown. Okay, the question is that the status of the Central Nebraska Veterans Home in Kearney, the last I heard, and who was the gentleman again?
Chris New from NTV.
Chris New from NTV, said the last he heard was on lockdown. Well, maybe in the vernacular, all 4 are on lockdown, because what we're locking down means we're not allowing visitors in. And as I mentioned a little bit earlier, every time that there's a positive case, you extend that time when you can allow visitors to come in. And we've had the succession of positive cases, so then when we get close to opening up, I think we had, Holden, I think in one place we had it for like a weekend. And then we had to go and shut down again. These are the directed health measures that our public health department, that ICAP, after consultation with those folks, that we implement. So I wouldn't call it a lockdown, but you know, that's his term, not ours. What we're doing is limiting visitation. And all 4 homes right now, not just the Central Nebraska Veterans Home, are limiting visitation right now. Which, and thank you for the question, because I should have said that earlier in my remarks. These members, our veterans and their spouses who are in these homes, deeply appreciate when the family can have those televisits, those window visits. So please keep on reaching out. That makes all the difference in the world. We are looking forward to the day when this is in the rearview mirror and we open up to visitors and volunteers again.
We have a couple other questions for the governor.
Sure.
Becca from NET asks, as hospitals correctly report the number of staff hospital beds to remove NICU beds, for example, are the NICU beds removed from all prior days
So Becca from NTV is asking with regard specifically around the NICU beds, were those removed from all the 14-day average? And the answer is yes.
Julie Anderson from the World Herald asks, has Test Nebraska been up and running all weekend? Has the Test Nebraska lab been running over the holiday?
So the Test Nebraska lab, and Dr. Anton, I'll ask you to verify this, but my understanding is the Test Nebraska lab has been running all weekend, so it ran Thanksgiving, ran Friday. The testing sites were not open on Thanksgiving, but the lab itself ran all those days. Is that?
That's correct.
That is correct.
Don Walton asks, do you have a message or any advice for Nebraskans who just returned from Thanksgiving travel?
So Don Walton's asking, do I have any advice for anybody who's returning from Thanksgiving travel? And again, as I said a little bit earlier, take advantage of Test Nebraska. If you were traveling, you want to come back and get tested, it's a great opportunity to sign up for Test Nebraska if you haven't already, and look for an opportunity to get tested.
Chris Dunker from the Journal Star says the White House Coronavirus Task Force has urged the state to implement a mask mandate since August, among other recommendations like closing bars and limiting gatherings. Why has the state not acted upon the guidance?
So Chris Dunker is asking, the White House recommendation has been putting out for months now that states should be, including Nebraska specifically, should be putting in a mask mandate, closing bars and restaurants, and taking other steps to limit gatherings. And we have directed health measures in place that, for example, require masks when you're going to be in a business that's closer, you're going to be closer than 6 feet for 15 minutes or more. We have taken steps to limit gatherings and so forth. We are putting together a plan that is right for Nebraska. And so that's what every state is doing, and that's what we've done here in Nebraska.
Those are all the ones I have.
Yeah, Andrew.
Governor, over the weekend, apparently, there's some social media posts that were attacking you, for going to a restaurant or a bar or something like that, not wearing a mask. I mean, how much are you concerned that this public shaming, is going on now? And how did you react to that when you were confronted by that?
So what Andrew's asking about is that there's some social media posting. Yesterday I went to a bar to Scriptown Brewery, very great host, great beer. And we were promoting Small Brewery Sunday. And I was sitting at a table and not wearing a mask because you're not required to wear a mask when you're sitting at a bar, sitting down at a table. And so people were complaining about that. So again, folks, I just say, understand what the rules are, use the mask when it's appropriate, and that's what we just got to keep doing. Is we're going to be doing this for a while, even though we hope, middle of December we'll be starting to get some of the vaccines for our healthcare workers. We're going to continue to have to manage this virus for the next several months, which means we're going to need to continue to use the tools we've been giving, the appropriate use of masks, keeping that social distance, washing your hands often. But also remember that we've got businesses out there that we're going to be supporting and be able to try and manage all this together, try to strike that balance.
Are you concerned though that that's, around the country, you're seeing more confrontations with people, who are frustrated because they don't believe enough is being done and they're confronting people who are not wearing masks?
So Andrew's asking about, well, what about the people who are frustrated because they don't believe enough is being done and are confronting people who are, for example, not wearing masks? And I just ask people to, leave a little space for grace for everybody. I've talked about it with our local public health departments, our contact tracers, and so forth. And again, you use the tools when it's appropriate. For example, if you're going to be in that business where you're closer than 6 feet for 15 minutes, you're supposed to be wearing a mask. If you're walking down the street, I believe even in Omaha you don't have to wear a mask if you're just walking down the street in Omaha. So I think there's, again, the appropriate use of masks is just one of the tools, but one tool by itself is not going to address the issues of slowing the spread. We have to use all of our tools together, that Swiss cheese layered effect that we talked about, how you have to use all these tools together to be able to slow the spread of the virus.
We have a question from the Lexington newspaper. Ryan wants to know, will the current direct health measures be extended past this date? He wants to know what the date is for the extension.
Brian at the Lexington Clipper, is that what who's from? Is asking about the current directed health measures that are set to expire today, and they will be extended through December 31st. Typically, that's what we've done with our directed health measures, is we put them in place for a month at a time. Obviously, we adjust them if we need to in the interim, but generally go through the month, so we'll be extending those through December 31st.
Julie Anderson says new cases and hospitalizations decreased a
So the question was, new cases and hospitalizations declined week over week. And I think, Dr. Anton, you said that's the first time we've had a week over week decline in hospitalizations since July. And so is this a blip, or is it because of the holiday weekend? It's really too soon to know at this point. That's why we encourage Nebraskans to continue, please, practice all the good tools that we've given you to be able to slow the spread of the virus, because while hospitalizations are down, we need to continue to be able to slow the spread of the virus to preserve our hospital capacity. Fred.
The question that you were asked earlier about the White House task force recommendations were publicized on Twitter by an Omaha writer named Dan Golden, and the one that he quoted from August 23rd said a mask mandate needs to be implemented statewide, and the one from November 22nd said ensure masks at all times in public. Are those accurate renditions of the recommendations? And in answer to the question previously, you described what the state has done, but the question was, why not do what the White House would recommend?
Okay, so again, the question Fred was asking specifically about some of the quotes out of the White House, documents they sent out with regard to August mask mandate and so forth. And again, I believe those are accurate. I don't have the documents in front of me to quote, but it sounds, within the spirit of what they were talking about. And the reason we are doing our own plan here in Nebraska is because we have 50 states, and they are using a larger kind of systematic or a program that is really looking at the entire country and then trying to apply it to Nebraska rather than looking at Nebraska-specific data, which we've talked about months ago. We had problems with the way the White House was collecting our data and using it, being inaccurate and so forth. So we put together here a plan in Nebraska that's right for Nebraska. So we listen to all sorts of experts. We take the White House information into consideration. We talk to our local folks, our public health directors. So we look at a variety of different sources to be able to come up with our directed health measures that are tailored specifically for Nebraska. Yeah, Andrew.
And I keep on getting the same question from some people. Why are we focusing on small businesses and bars and restaurants? If you're going to tighten things up, and not schools and other places that the spread could also be taken, could be spread out. And other, places of work like meat packing plants or different places that you have seen outbreaks.
So the question is, why do we, with our directed health measures, do we keep focusing on bars and restaurants versus things like schools, or you also talk about food processing plants as well, where we'd previously seen outbreaks. So again, these are just general things that we're doing when we're targeting those, because many people use those. It's a place where people socially gather. Schools, again, the consensus of our local public health directors is that there's very little outbreak in our schools, that our educators have done a great job of structuring that environment so that the kids are spaced out, they're wearing masks, they're washing their hands often. And we also know about the importance of kids being in school, right? Not only the academic progression, but also all the benefits they get out of being in school with regard to physical activity, mental health, nutritional needs, socialization. All these things are positive benefits that we get in the schools. So that's one of the reasons why the schools are taking steps to slow the spread of the virus in the schools, but we're not looking to close schools down unless there's a specific case where it would need to happen because they've got an outbreak or something like that. With regard to food processing plants, again, we worked with the food processing plants all throughout the spring to be able to put the structure in place to be able to help slow the spread of the virus, whether it was screening people coming in, wearing masks, addressing air handling systems, and so forth. So it's something that we got to continue to manage, in all these places where people gather. But so we're talking about all of them, and we have different plans or different approaches depending on what's appropriate for that venue. Martha. Oh, we got Martha had her hand up first. Martha.
According to this chart that you have, the number of the 14-day average of staff beds has gone down considerably, and so this looks like we actually hit the 25% mark earlier, but there were no the directed health measures did not change. So
Sure. So Martha's commenting on, it looks like the number of staff hospital beds has declined over the last couple of weeks. And that's one of the things that when we rolled out this plan a couple of weeks ago, we found that some hospitals were reporting their licensed beds. And so they started reporting the staff beds. And so that started bringing that number down. And against a 14-day rolling average. So that number has been coming down as those staff beds are being incorporated into the overall 14-day rolling average. So we did not hit the red, even I don't believe even in this chart here we hit the red. But regardless, it would be a 7-day rolling average to change from one zone to the next zone. And for the last week or so, we have seen declining hospitalizations. So we're going to continue to, both numbers float, how many hospitalizations we have and then how many staffed hospital beds. And we're going to continue to monitor both of those.
You said a 7-day average to change from one zone to another.
Right.
I thought it was 1 day.
Only on the way up. Only if we hit the red, it would be 1 day. But just in general, if we're coming back down, it would be a 7-day rolling average.
But you say that we did not hit.
I don't believe we did, no. And regardless, it would have been at the day that we hit, whatever day you're looking at, there was a different level for the number of average number of staffed hospital beds. So on that day, we did not hit it.
Do we know if this is an accurate number now?
Well, again, we're relying on hospitals to report the staffed hospital beds to us. So if the hospital's reporting us accurate data, then it's accurate. Andrew.
Is there any more money that hasn't been spent on the CARES Act funding, or that you could put out some applications and stuff like that? Has all that money been applied for, or is there still some left over? And is there a possibility that you might inject some more towards bars and restaurants that seem to be extremely hit hard?
So the question was, with regard to CARES Act money, what is the status of that? Is there any money left over, for example, to maybe do another round of stabilization grants to bars and restaurants? And we actually had November 13th was when we had the deadline for people to apply to the second round of stabilization grants, and we're still working our way through those grants right now. So we're going to be getting back to people to let them know whether or not they qualified and how much money for it. So if there is any additional money left over for it, right now it's all been kind of allocated to those different programs that we had, and we would have to, again, get all that money out the door by the end of December. So it's unlikely that there'll be additional money that's left over that will be going to stabilization grants at least this year.
Is that being said, are you talking to your congressional delegation to see if you can get more federal aid for some of these bars and restaurants, as well as individuals that may be laid off?
So the question is, well, what about another round of stimulus? Is the federal delegation working on that? I think it's unlikely that the federal government's going to act before the new president is sworn in.
U.S. Mark Balmer from KSMB asked, can you ask for comment on the scheduled meeting of the canvassing board today? It's scheduled for this afternoon.
So the question was about the canvassing board. For those of you not familiar, the canvassing board is the board that basically takes a look at the elections, see if we have to do any recounts, and basically it's just kind of the actual certification of the election results, pending any recounts that have to be done. And that is scheduled for today, so we'll be going through that process today, and part of the official business of how we run the election.
Becca Costello has a couple more questions. Are hospitals still correcting data about hospital beds, or is that mostly wrapped up?
So Becca Costello is asking, are hospitals still correcting data about hospital beds? And again, I think it's important to remember that when you're talking about staffed hospital beds, that will float up and down on a daily basis. That it depends on how much staffing you have. So so there's always going to be fine tuning with regard to those hospital beds going forward. It's not going to be a set in stone number. And then of course, one of the things that we have done is taken $40 million of that CARES Act money to distribute to hospitals so they can staff up. So we expect that those hospitals are using that money to increase their staffing to be able to accommodate more people in the hospitals.
And she says, is there any update on a CMS coding issue that may mean Nebraskans hospitalized for 21 days or more are not being counted?
So the question Becca's also asking is, there's a CMS coding issue around 21 days that people with coronavirus were being taken off the list as counting as having coronavirus after 21 days. And again, we're relying on hospitals to supply us that information, so we don't get involved with we're not dealing with the hospitals to tell them, oh, you have to take it all, follow CMS guidelines. No, what we've said is the hospitals need to report to us what their coronavirus patients are.
Those are all the following questions.
Yeah, Fred?
I think you dealt with this earlier, but I missed it. Were the DHMs scheduled to expire today and now they're being extended to December 31st?
That's correct. So the question was, DHMs, we usually put them in for a month at a time. So the current DHMs are set to expire today. We will be extending those for another month at the end of December, December 31st.
Same as they are.
Same as they are right now. Martha?
You made reference to the new president being sworn in. Have you decided that the legal options are exhausted for the current president?
Well, I don't believe that the legal options are entirely exhaustive for President Trump, but it seems unlikely that, given the current losses that the president has experienced in court, that he's going to be able to overturn the results of the election.
And
Yep.
so have you sent any messages to the president-elect?
I have not sent out any messages with regard to it, no.
Do you anticipate that?
Um, No, I'm not really anticipating it. Generally, I would expect the president-elect would be the one who would be reaching out. Yeah, Andrew.
What will your relationship be with the president?
Really, it'll depend upon the president-elect, what kind of relationship he wants to have with governors. President Trump has been one who's been very involved with the governors. Again, as I've often said, I think this was the most federalist administration we've had since Ronald Reagan. They truly believed in pushing power out of Washington, D.C. It'll be up to President-elect Biden to decide what kind of relationship he wants to have with the governors. Yeah.
Depending on the action people did or didn't take over the holiday weekend, when could we expect to see a spike if there is one that comes?
So the question was, if people were not good about having small groups over the holiday weekend, could there be a spike, and if so, when would that happen? And generally, you'd probably expect that. Well, hopefully everybody did a good job of keeping small groups and didn't have large family gatherings, but it probably would take a couple of weeks before you'd see the results of any additional spread beyond that. And again, we all have the opportunity to be able to slow that spread by using the tools that we have to be able to do that.
Chris Dunker has a follow-up question. Can you clarify what you mean when you said the recommendations from the White House task force were not tailored for Nebraska?
So if you look at the recommendations from the White House task force, they were pretty much the same for all the states. They didn't really change a lot from state to state. So they said the same stuff. Mask mandate, closed bars and restaurants. They weren't really looking at each state individually. It was kind of a cookie cutter kind of approach. Yeah, Andrew.
Are mask mandates effective if they're not enforced?
Are mask mandates effective if they're not enforced? Well, one of the reasons why we have taken an approach to really tailor our mask requirements is around using them in appropriate circumstances. But ultimately, at the end of the day, we don't have enough police to go out and enforce to make sure everybody's doing it when they're supposed to be doing it. And that's why we focus so much on educating people about the right circumstances to be able to wear that mask. For example, if you cannot avoid the 3 C's, wear a mask. Go to the store, wear a mask. If you're in a business where you're closer than 6 feet for 15 minutes, wear a mask. So we want people to adopt this as just part of how they manage controlling this virus that we're going to have to do for the next several months. So again, I just think you have to get people to understand the right time to use a mask and help educate people about it and get them to use it voluntarily.
But have we gone too far because it's become so politicized?
So the question was, have we gone too far? Have we gone too far because it's become so politicized? But again, I think that's where it just gets back to, you have to do the education. You have to talk to people about why it's important, what it'll do, what it won't do, right? It's not going to solve all our problems by itself, and that's why we have to use wearing a mask when it's appropriate with all the other things we do to be able to slow down this virus, like staying home when you're sick. All right, any other questions? All right, seeing none, Thank you all again for joining us here today. Please remember to follow all of our rules, use all of our tools to be able to slow the spread of the virus. We got to continue to make sure we protect our hospitals and make sure we can accommodate everybody who needs that acute care, that hospital bed, that ICU bed, or that ventilator when they need it. We've been able to do that so far. We need to continue to be able to slow the spread of the virus to be able to do that going forward. And again, we'll see everybody again 10 a.m. on Wednesday, 10 a.m. on Friday. Thanks very much. Thank you, Francis.
Thank you, Joe.